So what is the risk to the average person from COVID?
So I can speak to that. So in the early days of the pandemic, I ran a study in April of 2020 measuring how many people had been exposed to COVID and recovered from it. The way you measure that is you check for antibodies. So if you have antibodies are proteins that your body produces in response to infection to fight off the infection. And if you have them circulating, that means that you have the disease. And so I ran a study in Santa Clara County, California, where I live, and then also in Los Angeles County in early April, where we measured in LA and in Santa Clara how many people had it. It turned out to be about 50,000 infections in Santa Clara County, which was 50 times more infections than had been measured as cases. A whole bunch of people, about 1,000 people by early April of 2020 had been found to have COVID, gone to the hospital or shown up at the doctor, or tested positive somehow. But that was the tip of the iceberg. There are 50 times more people walking around. So if you then extrapolate that out and ask, well, of those people that died from COVID versus how many people actually had COVID, that turns out to be about 2 in 1,000. Survival rate of 99.8%. Now that's outside of nursing homes. Nursing homes include a lot of people that are older, a lot of people with comorbidities. The death rate was much higher in nursing homes. We were focused on the community, so.
But it's important to also realize that that number is for the population as a whole. So we have this huge age gradient. So for older people, it's actually slightly more. And for children, it's pretty much zero. Yeah. So for example, in Sweden, it was the only major Western country who kept their schools open during the winter, spring of 2020, that first wave of COVID. So in Sweden, 1.8 million children in ages 1 to 15, they all went to daycare and school as normally. So how many of those 1.8 million children do you think died during that first wave? Correct, there was none, 0 of them.
Yeah.
So and there were a handful that were hospitalized. And of course, children would get infected, so it wasn't that they didn't get infected. They were infected. So for children, this is a very, very mild disease with extremely low risk.
I mean, this is what about 100 antibody studies find the same exact thing you're saying, Martin.
Yeah.
They all find the average risk in the population is maybe of dying if you get infected with something like 0.2% or 0.3%, 99.7% survival, again, outside of nursing home settings. But very low risk to children, a much higher risk to adults, to old adults. 80% of the deaths, I think, in the United States and elsewhere have been in people over the age of 65.
Yeah, I can add a couple of numbers that are, I think, revealing. I mean, if you look at a lot of the epidemiology studies from people like John Ioannidis, when you take people under 70, the risk, the infection fatality rate is 0.04, 0.05. Okay, this is not very different from other viral diseases like influenza, but for people that are old and infirmed, and when we say old, there's a big difference. I mean, there's so many misconceptions here. Being old alone is not enough to be high risk, okay? When you look at the United States deaths, 2/3 of people who died have 6 or more comorbidities. That's not
comorbidity is?
A comorbidity is an underlying disorder. So for instance, if somebody has high blood pressure that's treated, and that's the only thing they have, which is very common in the United States, that's not enough to put you high risk. In fact, there are epidemiology studies that I actually showed at the task force that show that high blood pressure alone is not a significant risk factor for dying from COVID. But when you look at all the data, when you say 6 or more people, these are generally people for 2/3 of the deaths. Not all the deaths, but 2/3. So you're talking about people who are old and frail. Okay, they have things like diabetes, obesity, significant lung disease, heart disease, 6 or more comorbidities. That's a very different population than someone who's a very healthy person who's 65 years old. And Jay's exactly right, with 80% of deaths are over 65 in the US and all over the world. And in many countries, the median age of death from COVID, the mid person in the line of people who died from COVID, that median age is older than the life expectancy in many countries.
Wow.
Now, that doesn't minimize the deaths, of course. It just shows the perspective that I think the public never understood, because people who knew the clinical perspective were not speaking about that. And so the public health leadership, again, was really under-informing the public. It was not true that everyone has high risk to die from COVID. It is not true. It is not true that everyone has a significant risk for a very severe illness from COVID. In fact, most people do not.